Good morning, everyone, and thank you for joining us in this Hospice Care by Mitigare presentation today. I'm very happy that we have a full room today and also that we have several of our board members, of our collaborators, donors, volunteers, etc. Today, as part of the team, we have Les, we have Lisa, we have Marta, we have Dr. Lulu, we have Nancy, we have volunteers from now and from the past, like Joe, like Jill, like Robin, that has helped us in the past with the strategic plan. Of course, Lee, for example. So many of you that are here today can also be part of this list. So it's an invitation too. It is an honor to introduce for this presentation Dr. Lulú Tejeida, a distinguished professional in the fields of palliative care, hospice care, bioethics, and public health, specialist in bioethics from the Autonomous University of Nuevo León, with a master's degree in public health and health administration from the National Institute of Public Health. She is also a specialist in palliative oncology care from National Cancer Institute, which is the INCan here in Mexico. She's also a certified thanatology, clinical toxicology, and university teaching. She's a certified instructor in End-of-Life Nursing and Education Consortium, which is known as ELNEC. She is recognized as an Activist of the Year in 2022 by the NGO office from here in the municipality San Miguel de Allende. And in 2023, she received a state nomination for Women Who Changed the World, Inspiring to Greatness Award. Her work has impacted many lives, promoting education, support, and respect throughout the process of illness and the end-of-life care with dignity. With a career built in ethics, education, and community service, Dr. Tejeida shares her knowledge with us today to make palliative care and hospice care possible in Mexico. So, Dr. Lulu, say hi. We're also joined in this presentation by Nancy Stich, a woman with an exceptional career in healthcare, education, and community work. She served as a director of public relations and marketing at the ABC Medical Center, and after retiring, she continued collaborating on art consulting projects for the institution. Currently, as you heard before, she is the volunteer coordinator for Hospice Care Mitigare, coordinating efforts to provide palliative and hospice care in San Miguel de Allende. She has played a key role in teaching and developing educational programs, including her work at the Museum of Anthropology in Mexico City and as international high school educator. She is a co-author of books to support cancer patients and the history of medicine in Mexico. Nancy has worked with various associations, such as the American British Cowdray Hospital, Women's Auxiliary, the American Benevolent Society, and the Mexico City Garden Club. With this, she promotes social development and philanthropy. With an academic background in art history, social anthropology, and a master in business administration, and with her tireless spirit of service, Nancy inspires us with her vision of a world where knowledge, health, and community work in harmony. So this presentation is based to be with both of them today that we have here in the room. So Nancy, can you please stand up? And the main plan is that both can present today. We had some last-minute changes according to some medical situations, but we will work in team as we always do. Thank you.
We're going to kind of cover each other. Lulu has a terrible cold, but she's here. Well, good morning, and thank you so much for inviting us. This is really an honor for us to be able to present what our plan is. And we hope to involve as many of you as possible in the future with this wonderful project. And as you have heard, I'm sure, from Lee, we are the members. Some of you have met some of us. I'll introduce some members of our team a little bit further on. But the whole idea of hospice, obviously, is to add life to our days when the days no longer can be added to our life. And we're all going there. So it's important. A ver cómo es? Okay. Okay. I'm going to let Dr. Lulu talk about the next part. I'm relatively new to the group. She's been around a lot longer, so she can tell you a little bit more about our history.
sorry, but my cold is really bad today. And we are a nonprofit. We founded in 2016 with with a lot of friends. The principal angel in this part was Lee, and then we add Les, Marta, and people amazing like Carla and Nancy. Our mission, we have a mission, vision, and values. And the goal in our mission, vision, and values is the patient and the family. And the most important thing is the love, care, and the people who is involved in this particular care, who is the most important because it's the we provide care at the end of the life. And some of you in this room knows about us in a very, very close way. Do you want to talk about it?
Si quieres, yo les.
No, thank you.
Poor Lulu. Okay, this is the only, as we said, brick and mortar hospice in the entire country, which is, that's really saying something. There are approximately 5,500 in the United States. We're the only one here. And our main purpose is to relieve pain and control symptoms of those people at end of life. And this goes for everywhere from a 4-year-old child to a 99-year-old grandparent. Okay, it's really important because hospice care in Mexico is very a multicultural thing. It's very different than the United States. And that's why it's so important that you understand the difference between care that you would receive here or in Canada that you would receive in Mexico. Obviously, our intent is to improve end of life quality, make decision making and communication easier with the family members and the medical staff. A lot of times the patient gets lost in translation and he doesn't really get a chance to voice what he wants, or the family member might not be able to voice what they want. So this is very, very important. And what we really want to do is not have people pass in hospitals. They should be in the privacy of their own home where they're comfortable and where they feel good. And I'll explain a little bit later why we have in-bed facility, because not everybody has that possibility of dying at home. So here we have the differences, which is a big difference. End of life in a hospital, you're away from home, you're away from your loved ones. A lot of times you might have a couple minutes in the morning, a couple minutes in the afternoon to visit with your patient, and the rest of the time the patient is left alone. The last thing we want is for a family member to be left alone in this situation. Obviously, much, much higher costs, difficulty to access pain medications. It's when the doctor happens to show up or shows up and gives the medication to the person, whereas with our system, the doctor is always on call and ready to give the medication that is necessary. And limited space in hospitals. They want you in and out and on to the next. Whereas our care, basically all of our patients are taken care of at home. We have the medical teams that can tend to our patient in their own home so they can be surrounded by loved ones. They're getting comprehensive care from everyone from a physical therapist to a doctor to a thanatologist for the family members, but the whole family is being taken care of. Symptom and pain management. We do not have to wait for the doctor to be on call. Lulu and her team are on call 24/7. And home care equipment. A lot of people, all they need is just the equipment to get through what is the next step. And we have scaled payments. We'll talk a little bit about our payment plans, but it's very, very economical. It's on a basis of what the patient can pay. And we have social services that take care to investigate what the family can pay. Here's our Lee. This is our new center. Some of you might have seen it right where you turn to go to the botanical gardens. We're on the big street of Jose de la Cuesta. and you can come by anytime and see it. But on the hopefully the 29th of this month, we will have our inauguration of March. Sorry, in March. March. This is really important because we're building a supportive community. We're building a community with different medical institutions here in San Miguel, and not only medical institutions, but also chaplaincy and different community groups. So we're very involved with the whole community. And what we have is really fantastic. We have 3 inpatient rooms where patients can stay if they need to overnight or whatever the time that they need. And this is basically more probably for our expat community, people that don't have the facilities of having a family to take care of them at home. If need be, we can take care of them on the grounds. We have a day hospital. This was really helpful for our Mexican community, that if someone has to go to work and they have to leave their mother or grandmother, they know that they can bring her. She can be with us during the day. She receives medical care. And when the person comes back in the evening after he's finished his job or taken the child to school or whatever it is, and the patient is taken care of. We have administrative offices, a volunteer center. Really important is our conference room. We are making all sort of alliances with the different parts of the community, with the Red Cross, with groups like Jóvenes Adelantes, where Carla came from different groups that we can provide a space where lectures can be given, we can give courses, and all different kinds of things. Even Rotary. We have a non-denominational chapel. Where's Joe? Joe made the most wonderful, beautiful stained glass wall. It's really, really beautiful. And this chapel will be a very nice place for people to go, meditate, reflect. They can be there with their family member or by themselves and find a moment of peace. We're going to have a kitchen for our inpatients and also our day hospital patients. So they will have a nutritionist that will take care of their diets and make sure that they are fed correctly in the time that they're there. And we'll also provide a nutritionist that will help the family members make sure that they're getting the correct diet. And we can provide home care equipment that they can use and then bring back. This is our team. Some of our team is here. I'm going to have Marta stand up. She's our thanatologist. Marta right now runs bereavement sessions, and she's doing it at St. Paul's until we have our facility completely finished. But once it is, it'll be part of what's on our everyday schedule to have these sessions where Marta can be with more from 1 to, you said, up to 10 members of a family. It could be a crowd, a real crowd, but she's really taking care that the entire family is taken care of. A lot of times when a person passes over, there's differences between family members, and we should do this, and we should do that, and we should do this. And Marta is really good at talking to the entire family and bringing everyone into a cohesive way of dealing with the patient, so the patient isn't feeling conflict with his family either. And once the patient passes over, Martha has bereavement sessions that she continues to help family after the patients have died. We have, working with Dr. Lulú, she has nurses on staff, doctors, we have nutritionists, like I said, taking care of our kitchen, thanatologists, social workers that are going to go out and check what is the economic and emotional status of each patient and family member. We have caretakers that go to the families. That includes physical therapists. We have a chaplaincy group. We're actually working with several different religious groups right now, and we're trying to make that a larger thing. Martha will also be in charge of that area. We've had sessions with our Jewish communities, with the Anglicans, with the Catholics, and obviously there's a lot more groups. We started to make a list the other day, and it goes on and on and on and on. But we intend to get involved with all those groups to make sure that every patient feels comfortable, if they want it. It's not forced on them. It's just something, if they would like to feel that's something they want to do, that we can provide it for them. And volunteers. We need volunteers for everything. Everything from de-weeding the garden to helping out in the kitchen to making arts and crafts with the family members. We need a lot of volunteers. Right now, we have a volunteer that's helping us with our accounting, another one that's helping us with inventory of medical supplies, but we're going to need a lot of help. And some of our affiliations. These are a lot of the one that Lulú mentioned is the INCan, which is the Instituto Nacional de Cancerología. And all of these affiliations are really, really important because they give Lulú and her group all of the input that she might need on any particular case. And this is really important because each case is different. So it might be a cancer patient, it might be a Parkinson's patient, and she is able to go with our affiliations and get all of the help that she needs. We're affiliated with the Instituto Nacional de Cancerología, the, the International Association for Hospice and Palliative Care, the End of Life Nursing Education Consortium, in Asociación Latinoamericana de Cuidados Paliativos, just to mention a few. We're also affiliated with the DEEF, which helps children in Mexico, and several other associations. This is really important. Like I said, and Lulú can attest that whenever she has a special case, she can call in these specialists and say, what do we do about this? What does this person need to be fed? How does this person need to handle his pain? So we have this world of information that's really helping us out for specialized care. And our philosophy, how do I go back, Carla? Okay. So it's really important. Our inpatient and outpatient, we're going to analyze each patient on an individual basis. We'll go to their home, see what the situation is, see how much they can afford to pay. There's a system to work out payments. We evaluate each case with a social worker, with medical workers, again, comprehensive. And our goal is that people have an end-of-life experience that's just as good as their life, if not better. And I'd like Dr. Lulú, if she can, to mention our story about Princess. She was one of our, it's not her real name, but it's one of our recent patients that I think really affected us all. I went home and it was incredible. And just to show you that the humanity of this group, this little girl, which Lulú will tell you about, she's 4 years old, and she said she wanted gancitos. So Marta got up from the table from a board meeting and went to buy gancitos. And then she decided that day she wanted pizza. So they figured that out. But it's so humane. The treatment, we are treating a person. This is not an institution that is treating a patient. It's a real person. And Lulú can tell us a little bit about Princess's story.
This case is very particular because this case touched to all of us in a particular way. She had a very aggressive brain cancer, a brain tumor, and she was able to resist 4 surgeries before she passed. And we were involved with the family and all the care about Princesa. And as Nancy told you, she asked for gancitos. This a little piece of bread by Marinella, I think, and chocolate bread. It was her favorite dessert. So this case was so painful for us because she was in a very difficult situation. Princesa came from a very poor family and young parents. The mother is 20, 28, and the father is 20, 30, something like that. And they are so poor, and we were there for them. We work day and night providing symptom control. And as a slight end, this kind of support is not only about death, it's about the love and the care that we were able to provide because we are professionals in the field. And my invitation is to please help us to keep the support to all these families. And probably we don't know for ourselves and our loved ones. Thank you so much.
What we have been able to do to this up to this point, we've built the building. Now we have an even bigger goal, which is to pay for the monthly expenses of our patients. And that's where we're really going to need the help of our donors and our volunteers. And as we said, each plan is personalized. It fits the needs and budget of each family member. We can have from all over, from the campo. We tend to people Celaya, Querétaro, San Miguel, and the surrounding areas, and San Miguel, obviously. So this is our new fund. We have, like I said, we finished the building. Now we have to work on how we pay the bills every month. So that's what will be our next goal. So some of you that are obviously really good at making donations and making other people pay donations, we are going to need your help. So thank you. Thank you very much for letting us speak today and come and visit us. We're hoping that our inauguration will be on the 29th of March. And it's going to be something really, really special. I've just joined the group a couple months ago, and it's an incredible, incredible group of very humane volunteers. So we invite you all to join us and be part of the group. Thank you. Oh, okay. Carla, you want to talk about the grant? Okay.
If we go back to this one, this is like the special thanks for the clubs that are involved in this grant. Of course, you know that it's through Midday Rotary Club here in town, there in the room that you're here today. But we also have our international club, that in this case is Sime Sunrise and the Rotary Foundation. And in the next slide, you will see how it is the breakdown of our budgets that this global grant is happening now. We're right now doing like the purchase, doing like the orders with the suppliers, etc. So it mainly will be about furnishing, but as you see, it has other areas like the medical equipment, technical equipment, outreach programs, and education and training, because other of the big objectives that we have in the NGO, it's not only providing the care, but also teaching other professionals of health of how to do the proper care to the other beneficiaries. Because in that way, it's not with us, but it's like we're teaching more and more and more nurses, more doctors, more caretakers on how to do it in the proper way. One of the things that it's very sad that we have here in the country is that there might be other groups or associations that say, oh, we do provide like hospice care and palliative care, but then when you are there like in touch, or when you are like a beneficiary, you see that it's most about elderly care, and it's not about the symptom control, it's not about a personalized program, it's not about like providing this kind of dignity and in our case that kind of supportive care, not only to the patient but also in the family with the emotional part. So this is something that we're trying to promote like all over the country. As you know, in the past we had this congress in 2019. I hope that we can continue with that, but for now the plan is to provide this kind of educational programs in the center, and maybe soon more congresses.
Here's our information, and there's so many ways that people can help. You can be a volunteer at the center, obviously donations. We have an example, the San Miguel Quilters Association made this quilt that Lisa and I are both members of, which we've been selling raffle tickets to make money for the group. And we've already made how much, Lisa? Yeah. And the Mexico City, the San Miguel, the quilters group, are also making quilts for all the beds. So we're going to make it much more home. What's that? No, we have not sold the winning ticket yet. We can sell it to you today, and the raffle will actually be at our grand opening on the 29th of March. So that's the kind of people that come and help the group. There's all kinds of ways you can help. Like I said, even de-weeding the garden. There's lots of work to be done, and we hope to see you all up there soon. Thank you very much. Yes. A question?
I have a friend interested in volunteering. When did you say you would start training?
We're actually going to be training next month. I can give you a card, and I'm making lists of people
Perfect.
that have asked to help. It would help if you're bilingual, but it's not necessary.
She is bilingual.
Good.
So,
Well,
yeah.
I have my card, so we can write her on the list.
Great. Thanks.
Any other questions? Yeah.
So how many people are you serving right now on a regular basis?
Right now, we have only 3 patients, but in the past, we are treating around 155 patients.
Do you have access to the more expensive medical equipment like hospital beds and lift chairs that can be put in patients' homes?
Yes, actually, we are able to provide hospital beds, uh, bathroom,
Oxygen concentrators,
oxygen concentrators,
respirators,
all
wheelchairs,
kind of
walkers,
medical equipment.
canes.
Even not it's the goal, but we have some kind of monitors for patients in these special cases when the patient needs palliative terminal sedation according to the Mexican law.
Hi, thank you so much. I have 2 very quick questions. So the first one is you're going to be very successful. I'm pretty sure of that. So what will be the criteria if you get so much people to say, okay, you're going to get into the program or you won't get into the program? So that's number one. And number two, also very quick, is how is it going to be the supply for very restricted medicine in Mexico with this program?
Well,
Supply for narcotics, right? Pain medication, pain medication.
the first question was about the criteria.
First question is, how do we decide who we accept and who we don't accept?
Well, we accept almost all the patients, but absolutely the criteria consists in 5 points. How is the physical situation? How is the dependence of the others? How is the clinical stage? What kind of disease or what kind of illness the patient has? And 4, if the patient has the correct treatment. And 5, if the family is in the risks for, how do you call, to abandonar el paciente? To abandon the patient. But the most important criteria is the clinical stage for the inpatients. Inpatient. In outpatients, we take patients with criteria for less or more or less 6 months less about the clinical stage.
And the question you asked about medication?
We are able to provide morphine, fentanyl, oxycodone, hydrocodone, methadone, all kind of opioids for this kind of symptoms. And we provide immediately because we have our storage.
So let me remind you that 90% of hospice care takes place in the patient's home.
Right.
So the fact that we have 3 rooms is not really very much of a limitation, but we do have extra space up there, and we can add at least 4 rooms easily to our current facility if we find we need it.
With what we have right now, we have 3 rooms, but we do have plans in the future to extend. We still have property where we can make more patient bedrooms.
So in end of life legal issues, are you thinking about maybe having some legal referrals especially with expats. They have house problems, money, banks, cars, spouses.
Lee, you want to answer that one?
So, are you going to provide legal referrals for local lawyers that can help these individuals, especially expats?
Correct. Okay. Yes, we have an attorney on our board who is very familiar with all the end of life preparations and plans and wills and trust and all that kind of thing. And as part of our outreach program, we intend to do programs to help people with end of life planning. End of life planning would be advice about wills,
5 weeks of
advanced
sleep.
directives, and all those things that everyone should do. Very few people do, but we are going to do everything we can to help you with that kind of planning. Mike.
Thanks. I just want to thank Dr. Lulú. I took care of a person last year, had inoperable stage 4 cancer of the spine, and she died at home with her family around her, but without pain, thanks to you being there, and thanks to you showing up whenever we asked. So thank you again.
We have pamphlets of our group. It gives you a little bit of information and also donation possibilities just for our month-to-month expenses. If you're interested, come up and get one. And anybody wants to be a volunteer, write to them. Any other questions? Well, thank you very much.
Thank you. So this meeting is also broadcast by Zoom, and I want to recognize that we have a couple very special guests today. Rebecca Mendoza, who's the Regional Grants Coordinator for the Rotary Foundation, is online. He's been an amazing friend to us. And then also Chaz Wilson. And Chaz is our project partner from the Semi-Sunrise Rotary Club in California. And Chaz has been a project partner with me and this Rotary Club for at least 4 projects. So, Rebecca and Chaz, welcome. Thank you so much for joining us today. There's a message from Rebecca. What did Rebecca say? Thank you.
And also don't forget that if you want to receive the order of the day for our planning opening event, you can give us your contact information to add you in our mailing list. And also I forgot to mention a big volunteer that we have that is here next to us, Jose de Anda, and it's always here and there, here and there. So he's also supporting us to take the message into the group through the social media and everything. So there are several committees that you can be part of. So don't forget about us. You can volunteer us in many, many ways.
And we have this cup for your new kitchen. We all have to share it, but we can take turns. So thank you, everybody. Thanks so much for coming today. I'm so proud of all of you. It's amazing. So have a great day.